I'd say the biggest roadblock and challenge to implementing open source electronic health record systems is security. Doctors are interested in being able to use the system, and they should be. They want to make sure that they can get at the patient information when they need to, that it's correct, that it's verifiable. But another thing that has to be considered here, because we're dealing with people's personal health information, is of course privacy. And you can't have privacy without security. And electronic health records are pretty susceptible to security attack. When you consider the fact that there's, say, a 50-to-1 benefit ratio for an attacker for electronic health record information versus, say, credit card information. So if I'm an attacker and I steal your credit card, I can make $1, let's say. If I steal your personal health information, I can make $50. This makes EHRs a prime target. And the fact that they're being implemented for the purpose of meaningful use and not really with security in mind means that we could be looking for a serious disaster. What I'm working on would be trying to level the playing field a bit between those development organizations and those open source developers, but really also just making sure that you don't need a team of security experts who evaluate the security of a system. So my proposal is a methodology wherein any software tester can do security testing simply by looking at the requirement specification of the system. By looking at what the system should be able to do, they can make assumptions about what the system should not be able to do and write test cases for that system that check that it can't do those things. And currently security is assessed, or I'm having trouble finding the right word. Currently security is maintained through things like automated static analysis, automated application scanners, and there are very few of these tools that are open source and widely available, and they generally require you to pay a lot of money to be able to get your system to be more secure. So although my technique might not be as thorough as a tool like this, the idea would be you're either in any development organization or in an open source project, and you can run my methodology on the requirements, and testers will be able to just check for security problems that are of the simplest kind, so that if you do get a security expert, they can focus on the more pernicious and sort of devious security problems. I'm actually working with a proprietary company right now that I can't say the name of, but their idea is to have and they're not the only people with this idea, but the idea would be a network between the healthcare provider, the patient, and the doctor. The healthcare provider, the patient, and the family member. So say you have an elderly person in your family, your grandmother or your aunt or something, and she has a chronic disease. Well, she could have a terminal in her house or her apartment and be making daily updates about how she's feeling that day, or if she took her medicine or what have you. And the family member can look at this information on a website, as can the physician. So the accuracy of the information is, of course, extremely important, and humans are terrible at self-reporting. I mean, I can point you to 10 to 15 psychological studies that say exactly that. And that's a serious problem with electronic health records. One of the challenges you might see for electronic health records would be helping to make sure that information is accurate. Along those same lines, though, humans constitute the biggest portion of the problem in any software project. Software is used by humans. It's written by humans. It's maintained by humans. And humans are very unpredictable. The great part about electronic health record systems is that all the information that you would need to develop one, to implement one, to choose one is all becoming widely available on the internet. And I think software is greatly being distributed on the internet more than any other form now, and so that just makes sense. In terms of integrating Smarter Planet into my research, I participated in the Smarter Planet Jam. I forget when that was, but it was earlier, I think last year. And it was very interesting talking with different people about what a smarter planet would look like. And I actually am hoping to take a job, an internship with IBM this summer. I had one in 2009 and worked on their cloud computing solutions and had a really great time that summer. And so I'm hoping to do something similar this summer, only working with my topic and with healthcare. Smarter healthcare in an ideal way looks like a doctor not looking at the electronic health record system as something that gets in the way of them doing their job. The same for a patient. It looks like people trusting in the system that they're using to maintain their health information to save lives. Because, as it stands now, if I come into the ER, you don't know anything about me. You don't know what I'm allergic to. You don't know if I'm on SSRIs. You don't know anything about my health history. With electronic health records, I come into the ER, you somehow get my identifier, and you can look me up in the system, and you have all of my information. You know what you can give me, what you can't give. You know how to treat me, and you can save my life.